All right, so we are going to take a look at the larynx, pharynx, nasal concha. This is a mid-sagittal cut through the middle of the body. We can see the bisected head here. We've got our brain, spinal cord here, vertebral column, spinous processes coming off here. So we will have our frontal sinus here within our frontal bone. This is our nose, the cartilaginous portion. As we move back here, we're going to have our inferior, middle, and then just a little baby superior nasal concha. Those help with airflow, help with humidifying air, as well as catching particles that we breathe in. As we continue backwards, this area would be considered what is called our nasopharynx. There are not going to be clear delineations between the nasopharynx, oropharynx, and laryngopharynx. They're just kind of general broad regions. Posterior to the nose, we can see our sphenoid sinuses here. These are going to be within that sphenoid bone. Okay, so whenever you have like a sinus headache or allergies or things like that, the lining of your sinuses are what become infected and inflamed, and they can cause a lot of pressure because these spaces are not that big. So that's why when you go to the doctor, they tap on your face and your forehead. It's only mildly annoying. And then as we continue back, you'll see this little hole right here. This is going to be your auditory tube opening, or your auditory canal, or your eustachian tube, or your pharyngotympanic tube. So in anatomy, if there's one name for something, there's probably 7 other names, which is totally fine. Okay? So this is actually where your ears drain into your throat. And then as we go down, okay, we're going to get into the posterior portion of what we think of as our throat here. This is our tongue, this large thing. Okay? The tongue is an extremely strong muscle. This here would be our uvula hanging down in the back of our throat to give us that gag reflex. We can see our teeth here, our lips. This would be the mandible. We'll have our epiglottis here. This is what's going to be responsible for flipping over top of the larynx here when we swallow, so that food and water will go down the esophagus and not down the trachea into the lungs. As we move into the most anterior tube, this will be our trachea up here. The first structure that we're going to encounter is our larynx, or voice box. This area above the larynx is called your vestibule. So then this little structure right here, these are called your vestibular folds, or your false vocal cords, false vocal folds. Any of those are completely fine. That divot in the middle, that's called your ventricle. And then this structure below it, those are your vocal cords, or your vocal folds, or your true vocal folds, or true vocal cords. Okay. There are a number of little muscles in here that either flatten or straighten out or become shorter to create different pitches as we speak. And then as we go down, we'll get into the trachea and then into the lungs. Your thyroid cartilage is going to be anterior to the larynx. It actually houses the larynx. The thyroid cartilage is what creates the Adam's apple. And it's more pronounced in men because testosterone acts to enhance cartilage. Okay. And then below that, we will have our cricoid cartilage. Okay. So cricoid cartilage will actually encapsulate the entire structure of the trachea. Okay. Thyroid cartilage will not, and then as we go down, we'll have cartilaginous rings that will not close all the way. They'll just be C-shaped. Okay? The reason why we want that is as boluses of food go down the esophagus, they will actually push forward into the trachea, okay, as we swallow an entire piece of pizza all the way down. And I believe that is it on this model.